On the quorum call.
Oh, I'm sorry, Mr. President.
Senator is recognized.
Thank you, Mr. President. Mr. President, I come to the floor like many of my colleagues, shocked at the Republican majority's brazen, secretive effort to hijack the legislative process and pass a bill that would hurt millions of Americans. Now, I have served in public office for more than 4 decades. And never once in my 45 years as a mayor, a state legislator, a congressman, or a senator has it been so hard to understand the motivations of an opposing party. What kind of problems are Republicans trying to solve with legislation that raises premiums, reduces coverage, decimates Medicaid, and increases costs for everyone? Certainly not any of the concerns I've heard back at home in New Jersey. Never has someone come up to me at the local diner to say that their premiums are too low, or that Medicaid covers too many children, or that cancer patients don't pay enough out of pocket. There's only one place in America where these bad ideas have any traction, and that's behind closed doors here in Washington, where 13 Republican men are working on a secret bill to take health care away from millions of people and raise costs on millions and millions more. They want no transparency, no bipartisan input, no hearings. And these are the same Republicans who back in 2009 and 2010 accused Democrats of ramming health care reform through Congress too quickly. In fact, it was the majority leader who said at the time, and I quote, "This massive piece of legislation that seeks to restructure 1/6 of our economy is being written behind closed doors without any input from anyone." Even the vice president, a congressman at the time, said, quote, "It's wrong for legislation that'll affect 100% of the American people to be negotiated behind closed doors." Now, mind you, all of these complaints came during what was a far more open, transparent process. I sit on the Senate Finance Committee. I remember the process quite well. I remember our chairman at the time, Senator Baucus, bending over backwards to get Republican input. We held 53 meetings, hearings, and roundtables, and briefings, and negotiations on health care reform. And afterwards, we held the longest Finance Committee markup in over 20 years, a markup that led to the adoption of nearly a dozen Republican amendments, on top of the 24 amendments we accepted before the markup began. Democrats also made huge bipartisan overtures on the Health, Education, and Labor Committee. They too held a transparent process and adopted over 160 Republican amendments. 160 Republican amendments. Then, and only then, did we bring the bill to the floor of the United States Senate. And when we did, we spent 25 consecutive days in session debating the bill on the Senate floor in front of the American people. In short, Democrats spent months making compromise after compromise in the hopes of getting Republicans on board, only to learn that they never had any intention of working with us at all. They never cared about expanding access to care or reducing prescription drug costs for seniors or making insurance affordable. They didn't work with us then, and they're certainly not working with us now. Behind closed doors, 13 Republican men are debating just how many millions of Americans will lose their coverage under this bill. Is it 23 million? Is it 20 million? 16 million? Behind closed doors, they're discussing just how high the age tax should be on middle-aged workers. Is it $8,000 a year, $10,000 a year, $12,000 a year? Behind closed doors, they're picking and choosing which consumer protections to gut. Should they bring back lifetime limits on coverage, which is a real problem if you have a serious disease? Before, there were lifetime limits, so you had a coverage, and then all of a sudden you hit that ceiling. And if you had a challenge, for example, with cancer, and now you expended all of your coverage, but you still had an illness that needed to be treated, now you were one illness away from bankruptcy. Would you let patients with pre-existing conditions sink or swim in high-risk pools, allowing insurers to once again charge women more than men simply because they're a woman? Same age, same bracket, same geography? It's easy to see why Republicans want to keep this bill out of the public eye. If it's anything like the House version passed earlier this year, it is going to be a terrible, mean-spirited bill. A bill that the Congressional Budget Office said would take insurance away from 23 million people. It would raise premiums by 20% a year and price middle-aged consumers out of the market. A bill that, according to reports, even President Trump said is too mean. Well, I have to tell you something. If a bill is too mean for President Trump, it's certainly too mean for New Jersey. And today, I understand that a comment was attributed to the president. He was meeting with a group of business leaders, and he says he wants a health bill with heart. With heart. Well, I can tell you it's not this bill, because the House bill and what I'm hearing behind closed doors of the potential Senate bill, that's a heartless bill, not a bill with heart. I'm not the only one with that view. I was glad that most of my New Jersey colleagues in the House of Representatives rejected this bill in a bipartisan way. Indeed, every House Democrat and nearly every House Republican in our delegation understood why this bill would devastate New Jersey. This bill will price thousands of New Jerseyans out of the private health insurance market, especially those nearing retirement age. According to the Kaiser Family Foundation, premiums for a 60-year-old worker who earns $20,000 a year in Monmouth County will see their premiums increase by 900%. 900%. That's an increase of nearly $9,000. Every day, New Jerseyans are reaching out to tell me what's at stake in this debate and what this secretive effort will mean for their health and their financial security. Take Dr. Howard Fredericks, a 54-year-old constituent from Park Ridge, who emailed to say, quote, "Without subsidies provided under the Affordable Care Act, my 51-year-old wife and I would have no insurance. We would not afford premiums in excess of $1,100 a month. Without these subsidies, millions will go uninsured, and many of these people, including myself, will die." Of course, my Republican colleagues like to say their plan give Americans more choice. We don't know what the plan is, but they keep saying, at least the House plan, oh, we're going to give Americans more choice. But if all the choices are unaffordable, what good are they? What's good is to have, quote unquote, more choices if you can't afford any of the choices. And if they provide significantly less coverage, what good is it to say I have insurance when that moment that I get sick, I don't have the coverage for it? So I've been paying for a policy that doesn't really help me at the moment I need it. They also say their plan will give states more choice on how to run Medicaid. But when you cut Medicaid by $800 billion, you leave states no choice but to scale back the health services they provide. That's not choice. That's not choice. Leaving nursing home patients out in the cold, ending respite care for children with disabilities, denying low-income children a fair shot of the American dream, that's not choice. New Jersey alone will face $30 billion in cuts to Medicaid over the next decade. Cuts that will not only leave thousands of families uninsured, but according to the Milken Institute, cost New Jerseyans more than 41,000 jobs. So it's no wonder why Senate Republicans are terrified of having to defend this bill. It's a terrible, mean bill. And they don't have the guts to tell the American people what's in it, even though they want to pass it next week. If only they had the courage that so many New Jerseyans have shown me in recent weeks as I've toured our state. Hardworking Americans who have been willing to share their personal health care stories. Not easy to share a serious illness that you have with everybody in the world. But so compelled are they, and so courageous, I would add, that they do it. People like Irma Rivera, a constituent I recently met in Jersey City. She told me about her battle with uterine cancer nearly a decade ago. She was fortunate to survive. But without the Affordable Care Act, she'd be blacklisted by health insurance companies for the rest of her life, simply because she is a survivor of that cancer. Today, Irma is covered and receiving world-class care. I also met with Samantha Williams, a young mother in Burlington City. She told me about her son's brush with a life-threatening asthma attack. They were uninsured, so they avoided going to the emergency room, as so many people do. The illness gets worse and worse, more consequential to your life, more consequential to the cost. But eventually his breathing got so bad she had no choice. The doctor said if they had waited any longer, her son might have never made it. She credits Medicaid with saving his life. I also want to know how my Republican colleague can reconcile their concern with the opioid epidemic with their plan to end the Medicaid expansion that's saving so many lives. Just yesterday, I received an email from Irene in Oakhurst, New Jersey. She writes, quote, "My daughter is a recovering drug addict on the Medicaid program, which pays for mental health care and services. She's part of the opioid epidemic that has taken the lives of so many young people like her. She's been drug-free for almost a year. Taking money from this program would be disastrous not only for her, but for so many people who cannot afford any other health care." So I listen to those stories, compelling. They are courageous to tell their stories to the whole world, very personal stories. Yet there isn't the courage here to come forth with a bill and let's debate it open in public. This bill leaves millions of low-income Americans who depend on Medicaid expansion with no options at all. And for what? To give insurance, health executives, real estate moguls, and hedge fund managers a massive tax cut that they don't need? If there was ever such a thing as class warfare, this is it. This is it. In my home state of New Jersey, 250 millionaires are slated to get a collective tax cut of $14 million. Yep, you heard it right. 250 millionaires get a tax cut while over 500,000 New Jerseyans lose their health coverage. Pretty awesome thought. Incredible thought. Totally mean-spirited. Certainly without heart. Many of them are people who work in some of the toughest jobs, but they don't get health benefits at the jobs they work at. From dishwashers and cashiers and home health aides, just to mention a few. Now, these were my neighbors growing up in a tenement in Union City. People who worked tirelessly to give their children a better life, and so often put their own health on the back burner. Many of us thought that the cruel legislation Republicans passed through the House would be dead on arrival in the Senate. Instead, an incredibly unpopular bill has a new lease on life. Why? Because padding the pockets of the health insurance industry, capping Medicaid spending, and cutting taxes for millionaires have been at the top of Republican wish lists for years. The notion that the GOP can pass this secret bill with no debate is insulting to our democracy. And the idea that they can dismantle this historic law without hurting millions of people is just not true. It's just not true. Because make no mistake, when you take $800 billion out of Medicaid, everyone feels the pain. When you add 23 million people to the ranks of the uninsured, everyone feels the pain. When you send more people back to the emergency room as their way of getting health care, saddle consumers with higher out-of-pocket costs, and then protections against insurance company abuses for patients, everyone feels the pain. And what really boggles my mind, why I just can't understand, is that there's no shortage of problems in our healthcare system, real problems that need real solutions. Ask anyone, and I mean anyone, about our healthcare system, and I'll guarantee you'll get an earful about what's wrong with it. You'll hear from parents about deductibles that are too high, from workers about how hard it is to find in-network doctors, from seniors about generic drugs that suddenly cost thousands of dollars, police officers about the opioid crisis tearing apart our communities, and hospital staff concerned about the nursing shortage, business owners like the group I met from Cumberland County, New Jersey yesterday, who want Congress to work in a bipartisan way to lower employees' health care costs. Imagine just for a moment, imagine how thrilled Americans would be if Republicans actually had a bill that solved some of their problems instead of bringing back old ones. Imagine how excited would my Republican colleagues be to show off a bill that improved instead of endangered people's lives. But my Republican friends are not excited to show off this bill, because when you're excited to show off a bill, when you've got a great product, you want the whole world to know about it. But when you've got a terrible product, you don't want anybody to know about it. And they don't want to defend it because they know it's indefensible. Now, for 7 years, my Republican colleagues put politics over policy. For 7 years, they demonized Obamacare with no substance behind their rhetoric. Now their poll-tested platitudes have caught up to them, and they know it. They know it. That's why they've let 13 senators who represent less than a quarter of the country, 13 senators who represent less than a quarter of the country, meet behind closed doors. And that's why their hope is to keep this bill a secret until the very last minute. So today I've come to the floor with a message from my Republican colleagues. If you want to have a debate about how to improve our health care system, and about how to help more families get covered, and about how to lower costs more and create a healthier, more productive nation, these issues are issues that Democrats have been ready to have that debate. I've said it in the Senate Finance Committee. We did remarkable things under the Affordable Care Act, but there's still room for improvement. We're ready to have that debate, because Democrats know that while the Affordable Care Act was a historic law, a law that stopped insurance companies from dropping your coverage if you got sick, that covered 90% of Americans for the first time in our history, that required health plans to cover essential health benefits like visits with specialists, prenatal care, mental health and addiction treatment, hospital stays, and more. Despite all of the positive steps forward, despite all the good that the Affordable Care Act did, Democrats have never stopped believing that we could even make it better. But before we can make our health system better, we must stop Republicans from making it worse. We cannot go back to a time when health care was a privilege granted only to those who could afford it, when it must always, I think, be a right afforded to all Americans. The only way we can go forward is by working together, with bipartisan input, with open debate, with full transparency on an issue that affects virtually every American, in full view of the American people we were elected to serve. They deserve no less, but they are getting a lot less by the majority as it relates to this bill behind closed doors, in secret, that even the President of the United States is mean. Well, the one thing I can agree with President Trump, we need a bill with heart. And from what I've seen and heard so far, this is pretty heartless. Mr. President, with that, I yield the floor.
Mr. President. President.
Assistant Democratic Leader.
Let me thank my colleague from New Jersey for his excellent remarks on this Affordable Care Act and its future, and really spotlight the point that you made. You and I have been around legislatures for a long time, both in local level, state level, and here in Washington.